Cushing's syndrome or hypercortisolism is an endocrine disorder that is caused by having too much of a hormone called cortisol in the body. It is more common in people who have been taking steroid medicine for a long time. The etiology of Cushing's syndrome can be divided into two categories, the endogenous and exogenous hypercortisolism. When we say endogenous, it means that the cause of hypercortisolism is originating from an internal source or the body itself is producing too much cortisol. On the other hand, exogenous hypercortisolism is caused by an outside source such as administration of steroid medications over a long period. Cushing's syndrome can be classified into two categories, the ACTH dependent and the ACTH independent Cushing's syndrome or hypercortisolism. ACTH dependent Cushing's syndrome occurs when body makes too much ACTH, which in turn increases the cortisol production, such as pituitary adenoma, ectopic ACTH syndrome and ectopic CRH syndrome. Endogenous glucocorticoid overproduction or hypercortisolism that is dependent of ACTH is usually due to a pituitary tumor secreting adrenocorticotropic hormone or ACTH, which commonly the cause of Cushing's disease among women. While ectopic ACTH syndrome, caused by non-pituitary tumors which secrete either adrenocorticotropic hormone, ACTH, and corticotropin-releasing hormone, CRH, and cause bilateral adrenal hyperplasia are more common in men. In contrast, ACTH-independent Cushing's syndrome is caused by either both adrenal glands are hyperactive or there is an adrenal tumor that is making too much cortisol. It may also develop from taking oral corticosteroid medications, such as prednisone, in high doses over time. The risk factors for Cushing's syndrome are sex and age. Particularly, it's more prominent in females than in males. Commonly affects people aged 25 to 50 but can also occur in children. The etiology of Cushing's syndrome arises from various factors. One is alcoholism. One cause of developing symptoms and signs of Cushing's is excessive alcohol intake. This is called pseudo-Cushing's. This is thought to occur due to an effect on the liver which decreases the clearance of cortisol, resulting in excessive urinary cortisol. Endogenous sources, tumors of the pituitary and adrenal gland as well as from ectopic source. Prolonged administration of corticosteroid medications and ACTH excess. Lastly, is the adrenal hyperplasia that causes excessive cortisol production. Signs and symptoms of Cushing's syndrome vary. People who have very high levels of cortisol for a long time are likely to have clear signs of the disorder, including obesity and weight gain occurs due to stimulation of adipogenesis. Increased blood pressure. Increased blood glucose. Thinning of the skin. Purple stretch marks. Hyperpigmentation. Gonadal dysfunction. Women with Cushing's syndrome may also experience irregular menstruation. In some cases, menstruation is absent altogether. Untreated Cushing's syndrome in women can lead to difficulties becoming pregnant. In men, on the other hand, this can lead to erectile dysfunction, a loss of sexual interest and decreased fertility. Next is hirsutism. Women may develop extrafacial and body hair which often occurs on the face, neck, chest, abdomen, and thighs due to high levels of testosterone. Lastly is body weakness. Before going to the disease process, first, let's review the normal anatomy and physiology of organs involved in Cushing's syndrome. To start with, the adrenal glands, also known as the suprarenal gland, are small, located on top of both kidneys. It is made up of two main parts, the adrenal cortex and the adrenal medulla. The adrenal cortex is the outer region and the largest part of an adrenal gland. It is divided into three separate zones, zona glomerulosa, zona fasciculata, and zona reticularis. The function of adrenal cortex is necessary for life, making it possible for the body to adapt to stress of all kinds. The three types of steroid hormones produced by the adrenal cortex are mineralocorticoid aka aldosterone, produced by the zona glomerulosa. This particular hormone plays a central role in regulating blood pressure and certain electrolytes such as sodium and potassium. It also helps regulate the blood pH by controlling the levels of electrolytes in the blood. Next is the glucocorticoid aka cortisol produced by the zona fasciculata. This steroid hormone has a catabolic effect on carbohydrates, fats, and proteins, suppresses inflammation, has a diabetonic effect on blood sugar, and can also decrease bone formation. It also controls the sleep-wake cycle. Lastly, the androgenic hormones produced by zona reticularis are weak male hormones. They are precursor hormones that are converted in the ovaries into female hormones, estrogens, and in the testes into male hormones, androgens. However, estrogens and androgens are produced in much larger amounts by the ovaries and testes. Without the adrenal cortex, severe stress would cause a dysregulation of the peripheral circulation, causes circulatory shock and prostration. Survival in the absence of functioning adrenal cortex is possible only with nutritional, electrolyte, and fluid replacement and proper exogenous adrenocortical hormones. The second part of the adrenal gland is the adrenal medulla, which is located inside the adrenal cortex in the center of the adrenal gland. It produces stress hormones. The hormones produced by adrenal medulla include epinephrine and the norepinephrine. These hormones initiate the flight and fight response. They are capable of increasing the heart rate and force of heart contractions, increasing blood flow to the muscles and brain, relaxing airway smooth muscles, and assisting in glucose metabolism. The second organ involved is the pituitary gland. The pituitary gland is known as the master gland since its hormones regulate other parts of the endocrine system, including the thyroid gland, adrenal glands, ovaries, and testes. Even so, the pituitary gland doesn't run the entire show. In some cases, the hypothalamus instructs the pituitary gland to increase or decrease hormone production. Essentially, the pituitary acts after the hypothalamus prompts it. The pituitary gland is only about 1/3 of an inch in diameter, that's about as large as a pea, and located at the base of the brain. Since their functions are so intertwined, it's no surprise that the hypothalamus and pituitary are located near each other. They're actually connected by the pituitary stalk, or more technically, the infundibulum. The pituitary glands are made of the anterior lobe and posterior lobe. The anterior lobe produces and releases hormones. On the other hand, the posterior lobe does not produce hormones per se. This is done by nerve cells in the hypothalamus, but it does release them into the circulation. The anterior lobe releases hormones upon releasing or inhibiting hormones from the hypothalamus. These hypothalamic hormones tell the anterior lobe whether to release more of a specific hormone or stop production of the hormone. The major hormones produced by the pituitary gland are ACTH, FSH, GH, LH, prolactin, and the TSH. ACTH stimulates the adrenal glands to produce hormones such as cortisol, aldosterone, and androgen. The follicle-stimulating hormone which works with LH to ensure normal functioning of the ovaries and testes. Another is the growth hormone, whichever is essential in early years to maintaining a healthy body composition and for growth in children. In adults, it aids healthy bone and muscle mass and affects fat distribution. The luteinizing hormone has similar function with FSH, prolactin, which stimulates breast milk production. Lastly, thyroid stimulating hormone, which stimulates the thyroid gland to produce hormones. The posterior lobe, on the other hand, produces two hormones, vasopressin and oxytocin. These hormones are released when the hypothalamus sends messages to the pituitary gland through nerve cells. Vasopressin is also known as antidiuretic hormone, prompts the kidneys to increase water absorption in the blood. And oxytocin is involved in a variety of processes, such as contracting the uterus during childbirth and stimulating breast milk production. The third organ involved is the hypothalamus. The hypothalamus is a small region of the brain. It's located at the base of the brain, near the pituitary gland. While it's very small, the hypothalamus plays a crucial role in many important functions, including releasing hormones, regulating body temperature, maintaining daily physiological cycles, controlling appetite, managing of sexual behavior, and regulating emotional responses. The hypothalamus has three main regions. Each one contains different nuclei. These are clusters of neurons that perform vital functions, such as releasing hormones. Anterior region, this area is also called the supraoptic region. Its major nuclei include the supraoptic and paraventricular nuclei. The nuclei in the anterior region are largely involved in the secretion of various hormones. Many of these hormones interact with the nearby pituitary gland to produce additional hormones. Second, middle region, also called the tuberal region. Its major parts are the ventromedial and arcuate nuclei. The ventromedial nucleus helps control appetite, while the arcuate nucleus is involved in releasing GHRH. Lastly, the posterior region, this area is also called the mammillary region. The posterior hypothalamic nucleus helps regulate body temperature by causing shivering and blocking sweat production. Hormones produced in the anterior region include CRH. This releasing hormone involved in the body's response to both physical and emotional stress. It signals the pituitary gland to produce a hormone called ACTH. ACTH triggers the production of cortisol, an important stress hormone. TRH, which stimulates the pituitary gland to produce TSH. TSH plays an important role in the function of many body parts, such as the heart, gastrointestinal tract, and muscles. Third, GnRH, which causes the pituitary gland to produce important reproductive hormones, such as FSH and LH. Fourth, oxytocin, which controls many important behaviors and emotions, such as sexual arousal, trust, recognition, and maternal behavior. It's also involved in some functions of the reproductive system, such as childbirth and lactation. And then, vasopressin, also called antidiuretic hormone, this hormone regulates water levels in the body. When vasopressin is released, it signals the kidneys to absorb water. Last is somatostatin, which works to stop the pituitary gland from releasing certain hormones, including growth hormones and thyroid-stimulating hormones. Cushing's syndrome involves the HPA axis, causing excess cortisol release from the adrenal glands. When the normal function of the glucocorticoids becomes exaggerated, a wide range of physiologic responses can be triggered. The HPA axis encompasses physiological feedback and central integrative control, and the control of the synthesis of CRH in the hypothalamus, ACTH in the anterior pituitary, and cortisol in the adrenal cortex. Hypothalamus produces CRH that stimulates the corticotrophs in the anterior pituitary to secrete corticotrophin or ACTH into the bloodstream. ACTH is carried in the circulation to the adrenal cortex, where it stimulates the zona fasciculata and zona reticularis, which produce cortisol and androgen. In Cushing's syndrome, too much cortisol may be caused by several mechanisms, including pituitary adenoma that secretes ACTH and stimulates the adrenal cortex to increase its hormone production despite of adequate amounts. Primary hyperplasia of the adrenal glands in the absence of a pituitary adenoma is less common. Another less common cause of Cushing's syndrome is the ectopic production of ACTH by malignancies. Bronchogenic carcinoma is the most common type. Regardless of the cause, the normal feedback mechanisms that control the function of the adrenal cortex become ineffective and the usual diurnal pattern is lost. The signs and symptoms of Cushing's syndrome are primarily a result of oversecretion of cortisol and androgen, although aldosterone also may be affected. Patients with Cushing's syndrome have elevated blood pressure as a result of the stimulation of the zona glomerulosa to produce aldosterone. Aldosterone mainly acts as main regulator of salt and water in the body. High levels of aldosterone increases electrolyte levels including sodium, which can cause to vasoconstriction, making the blood vessel opening smaller. The tightening of blood vessels raises blood volume and pressure, causing the left ventricle to thicken, resulting in cardiac hypertrophy. Aldosterone raises the amount of sodium in the body, resulting in hypernatremia, high serum sodium levels. Another electrolyte imbalance in Cushing's syndrome is hypokalemia. Aldosterone also causes an increase in potassium excretion, which affects electrolyte and fluid balance in the blood. Long-term cortisol elevation consistently produces glucose, resulting in elevated blood sugar levels. It occurs because cortisol increases gluconeogenesis to compensate for the body's need for energy during stressful conditions. As we all know, a rise in blood sugar levels causes increased urination and thirst, and excessive hunger. People with polyuria produce more than 3 liters of urine in a day. When blood glucose levels are too high, your body will try to remove some of the excess glucose via urination. This causes your kidneys to filter out more water, increasing your need to urinate. With high blood glucose, your kidneys produce more urine in an attempt to flush the excess glucose from your body. Meanwhile, since your body is losing fluids, your brain instructs you to drink more to compensate. This results in intense thirst associated with diabetes. Polyphagia or increased hunger is due to loss or excess glucose in urine that leads the body to crave for more glucose. Cortisol alters the immune response, causing a decrease in lymphocyte levels and an increase in neutrophils. In fact, it inhibits interleukin-2 production. Reduced interleukin-2 levels inhibit the growth of T lymphocytes, which play an important role in helping the body fight infection. As a result, lymphocytes are low. Another disadvantage of elevated cortisol is that it causes detachment of the marginating pool of neutrophils in the bloodstream and increases circulating neutrophil levels despite no increase in neutrophil production. To attach to the endothelial lining of the blood vessel, neutrophils use cell adhesion molecules called L-selectin. However, cortisol has been shown to reduce L-selection gene transcription, thereby reducing the amount produced and transferred to the surface to replace recently shed L-selectin. Without this replacement, the neutrophil will detach, resulting in a prolonged transit of neutrophil to or through specific organs. When blood sugar levels are too high, the pancreas secretes more insulin, resulting in central obesity, moon face, buffalo hump, and abdominal obesity. One of insulin's primary functions is to inhibit fat breakdown in adipose tissue and to stimulate lipogenesis primarily through the activation of 2 enzymatic pathways. It targets adipocytes around the waist and buttocks, activating lipoprotein lipase, an enzyme that aids adipocytes in storing more fat. Excessive cortisol production inhibits calcium absorption, resulting in decreased bone formation. Calcium is a mineral that is necessary for the formation and maintenance of bones. Cortisol promotes proteolysis, breakdown of protein. The purpose of proteolysis is to provide amino acids to the relevant tissue as building blocks for gluconeogenesis. Protein synthesis is reduced as proteolysis increases. Protein is the main component of muscles and bones, and it is necessary for the body to move. A decrease in protein synthesis causes muscle wasting, which weakens the body. Cortisol also promotes the catabolism of dermal proteins such as collagen and elastin, which are necessary for skin elasticity. Skin atrophy, fragility, striae, and easy bruising result from a disruption in its synthesis. Hormones associated with the HPA axis, such as CRH, ACTH, and glucocorticoids, have been shown to suppress GnRH secretion at the hypothalamic and or pituitary levels. GnRH suppression reduces FSH and LH, the hormones responsible for the secretion of estrogen and inhibin. Estrogen and inhibin both play important roles in the regulation of the menstrual cycle. Low testosterone levels in men reduce libido and sperm production. Because of the stimulating nature of ACTH on the reticulated area, which can cause excessive androgen secretion, Cushing's syndrome can cause hirsutism and virilization in which female patients develop characteristics associated with male hormones. High cortisol levels stimulate the sebaceous glands of the skin to produce more sebum, oil. The extra oil clogs the pores, causing inflammation and bacteria to grow, resulting in acne. Cushing's syndrome due to excess ACTH may also result in hyperpigmentation. This is due to melanocyte-stimulating hormone production as a byproduct of ACTH synthesis from POMC gene. In addition, ACTH activates MSH, which then targets melanocytes and increases melanin production. Melanin help protects epidermal cells from UV rays, but too much melanin causes skin and mucosal discoloration.